Hi, my name is Chloe Whipple, and my applied project is on reishi supplementation for inflammation management in adults with rheumatic diseases. Hi, my name is some background and significance. Some systemic rheumatic diseases include Sjogren's syndrome, systemic lupus erythematosus, and rheumatoid arthritis, which all cause systemic inflammation, which means that there is chronic inflammation in any organ system in the body since it is a systemic disease. Chronic inflammation is a hallmark of autoimmune diseases, which can be induced by environmental factors and infections that lead to an autoimmune response, which is most commonly caused by inflammatory responses in the joints, muscles, organs, via the release of pro inflammatory cytokines. Some background and significance. In treating rheumatic diseases like Sjogren's, lupus, or rheumatoid arthritis, disease modifying anti rheumatic drugs, also known as DMARDs, are commonly used, and they were designed to reduce symptoms of inflammation in individuals with rheumatic diseases. Non-steroidal anti-inflammatory drugs, also known as NSAIDs, are commonly used to reduce pain and inflammation in rheumatic conditions, and these work by inhibiting the cyclooxygenerase enzymes, also known as COX or COX-2. Chronic inflammation is driven by immune dysregulation, the autoantibodies, and elevated cytokines, as well as pro-inflammatory cytokines, which are the same thing as cytokines. The most common ones in these rheumatic conditions are the tumor necrosis factor alpha, interleukin 6, and interleukin 1 beta. Many patients with RA, Sjogren's, and lupus continue to experience chronic systemic inflammation despite conventional pharmaceutical treatments like DMARDs, biologics, and steroids, underscoring the need to explore evidence-based complementary adjunct anti-inflammatory therapies in these rheumatic conditions. Ganoderma lucidium, also known as reishi or G. lucidium, is a powerful, potent, functional mushroom that has been referred to as the herb of spiritual potency. It has traditionally been used in Eastern medicine. G. lucidium is made from various bioactive compounds like triterpenoids, polyphenols, and polysaccharides. G. lucidium has anti-inflammatory, immunomodulatory, and antioxidant properties. There is potential to reduce cytokine production and disease activity by utilizing reishi. Ganoderma. The purpose of this project is to educate healthcare providers as well as patients on the potential anti-inflammatory effects of reishi supplementation in adults diagnosed with RA, Sjogren's syndrome, or lupus. Considering integrative evidence-based interventions is crucial in managing and treating chronic systemic inflammation observed in these rheumatic conditions. The research question is, for adults ages 18 to 60 years old diagnosed with RA, Sjogren's, or lupus, does daily supplementation of G. lucidium reduce inflammation levels while decreasing disease activity compared to the absence of G. lucidium supplementation? The population this research question will be focused on are adults ages 18 to 60 years old diagnosed with RA, Sjogren's, or lupus. The intervention will be daily supplementation of 1,500 milligrams of G. lucidium. The comparison will be the control group or placebo supplementation group, and the outcome will be reduced inflammation as seen in the C-reactive protein and the erythrocyte sedimentation rate. Cytokine levels will be decreased and disease activity will improve, as well as quality of life score. Some definitions of terms are Ganoderma lucidium is a medicinal mushroom traditionally used in Eastern medicine for its anti-inflammatory and immunomodulatory properties. C-reactive protein, also known as CRP, is an inflammatory biomarker produced by the liver in response to inflammation. CRP will be measured in this study by a high sensitivity CRP blood test to assess systemic inflammation levels. CRP is expressed in milligrams per deciliter, with levels of 1 milligram per deciliter indicating inflammation. Erythrocyte sedimentation rate, also known as ESR, is a blood test that measures the rate of how quickly erythrocytes settle in a test tube. ESR will be assessed by the Western Gren method and expressed in millimeters per hour. An ESR of 20 millimeters per hour for females 50 years or older is considered an elevated level of inflammation. Pro-inflammatory cytokines are cytokines that are small proteins that mediate and regulate immune responses and inflammation. These pro-inflammatory cytokines will be measured by an ELISA or multiplex assays to quantify the levels in the blood. Disease Activity Score 28, also known as the DAS28, is a composite score used to assess disease activity in RA. It includes the number of swollen and tender joints, CRP or ESR levels, and the patient's self-reported global health assessment. DAS28 scores range from 0 to 10, with higher scores indicating more active disease activity. The EU LAR Sjogren's Syndrome Disease Activity Index, also known as the ESSDAI, is a scoring system used to assess systemic disease activity in Sjogren's syndrome. The ESSDAI evaluates the involvement of 12 organ systems, with higher scores indicating greater disease activity. Lupus Disease Activity Index 2000, also known as the SLEDAI-2K, is an index used to assess disease activity in patients with lupus. The index scores 24 clinical and laboratory criteria to quantify disease severity, with higher scores indicating greater disease activity. Quality of life scale is a patient-reported outcomes that reflect physical, emotional, social well-being. In this study, quality of life scores will be assessed using validated questionnaires using Likert scales. So some definitions of terms. Th17 cells promote autoimmune activity and drive inflammation, while Treg cells, also known as regulatory T cells, work to suppress these responses and help maintain immune system balance. Anti-dsDNA, also known as anti-double-stranded deoxyribonucleic acid antibodies, are used as an indicator for lupus activity as well as for lupus diagnosis. Nuclear factor kappa B, also known as NF kappa B, and the MAPK pathways play a critical role in controlling inflammation by regulating key cellular responses. When activated, these pathways trigger the production of pro-inflammatory cytokines, which drive the body's inflammatory response. MMPs, matrix metalloproteinases, is a group of enzymes that play a significant role in the extracellular matrix of cartilage and joint tissues, causing joint damage and inflammation. Nerve growth factor and brain-derived neurotropic factor are proteins that play a critical role in neural growth and survival, as well as they play a crucial role in mood and overall well-being. INOS is a form of derived nitric oxide, and the production of INOS has been linked to numerous diseases. Nitric oxide produced by INOS is a key regulator of multiple biochemical processes, including glucose and lipid metabolism, particularly during inflammation. mTOR slash the MAPK, also known as the mechanistic target of rapamycins, mTOR, is critical for cell growth, metabolism, and longevity. The MAPK pathway can activate mTOR inhibition, which can sometimes lead to MAPK pathway activation, which is commonly associated with the development of cancer as well as linked to inflammation. Th17 findings from the literature review showed that RLZ8, which is a recombinant protein extract from reishi, increased IL-10 and decreased IL-7A, which altered the Th17 TREG balance, which is beneficial in autoimmune regulation. This study focused on the ability for the recombinant protein RL78 to reduce inflammation in the lungs in an OVA-induced in vivo study. Th17 and TREG balance is essential for managing autoimmune diseases. Th17 cells promote inflammation, whereas the TREG cells help regulate and suppress it. Another study conducted on lupus-prone mice treated with reishi and san blend showed reduced proteinuria, anti-dsDNA antibodies, and pro-inflammatory cytokines, suggesting a decrease in disease activity and inflammation. There was an increase in T regulatory cells and interleukin 2, indicating enhanced immune regulation. The study also noted improved kidney histology. It was also shown to have protective effects on the liver. Another study explored reishi in the context of rheumatoid arthritis. Multiple studies were reviewed showing that reishi polysaccharides reduce levels of tumor necrosis factor alpha, interleukin 6, and interleukin 1 beta, which are all critical pro-inflammatory cytokines in RA. These compounds also inhibit key inflammatory pathways like NF-kappa B and MAPK, while reducing enzymes like MMPs, which are responsible for joint damage and inflammation. A neuroimmune mechanism was found in another study, which showed reishi stimulating neurotropic factors like nerve growth factor and brain-derived neurotrophic factor, while suppressing INOS and NF-kappa B, suggesting both anti-inflammatory and neuroprotective potential, which could be relevant for patients with overlapping central symptoms. Other cancer studies have been conducted supporting broader anti-inflammatory activity. In an inflammatory breast cancer model, researchers demonstrated that reishi significantly reduced tumor volume in mice with inflammatory breast cancer. These effects were linked to the downregulation of mTOR and MAPK signaling pathways, highlighting reishi's ability to reduce protein synthesis and inflammation, even in aggressive disease models. The triterpenoid compounds found in reishi were shown to suppress inflammatory mediators such as nitric oxide, reactive oxygen species, and COX2 enzymes in microglial cells. These findings highlight the downregulation of inflammation through inhibition of the MAPK and NF-kappa B pathways, reinforcing reishi's cellular level impact on inflammation. In human immune models, reishi was derived from a protein RLZ8, and it was found that it stimulated dendritic cell activation, increased T cell proliferation, and upregulated interleukin 10 secretion, an anti-inflammatory cytokine. This demonstrates how reishi may modulate adaptive immune function, which could be beneficial in autoimmune diseases. Another study conducted in 2019 tested a mushroom blend that included reishi on human macrophages. While it increased pro-inflammatory cytokines, it also decreased interleukin 10, suggesting the immune effects of reishi can vary depending on the context and the formulation. Altogether, these findings reinforce the immunomodulatory versatility of reishi across cancer models, cellular pathways, and human immune cells. Other cancer studies have been conducted supporting broader anti inflammatory activity. In an inflammatory breast cancer model, after exploring the role reishi plays in managing inflammation in rheumatic diseases, it is clear we need more high quality clinical trials in humans to fully understand the benefits and make evidence based recommendations to our patients regarding the immunomodulatory effects that reishi can have, as well as the anti inflammatory effects. After reviewing multiple animal and cell studies, reishi consistently lowered key pro inflammatory cytokines like tumor necrosis factor alpha, interleukin 1 beta, and interleukin 6. These markers are major drivers of inflammation in conditions like RA, Sjogren's, and lupus. There's also evidence, mainly from animal models and a few small human studies, that reishi may reduce C reactive protein and erythrocyte sedimentation rate, which are blood test markers for inflammation. It mostly just shows you a picture of the systemic inflammation that's going on in the body, more so than where the specific inflammation is stemming from. But this is especially relevant because a lot of patients with rheumatic conditions struggle with ongoing inflammation, even when they're on medications like DMARDs or biologics or NSAIDs, highlighting the need for adjunct therapies to conventional rheumatic treatment. What stood out to me with reishi was the effect that it has on immune regulation. It boosts interleukin 10, which is a powerful anti inflammatory cytokine, as well as increased T regulatory cells, which help calm an overactive immune system, which are crucial in managing an autoimmune disease. At the cellular level, reishi was shown to block some of the main pathways involved in inflammation, like NF kappa B, MAPK pathway, and mTOR pathway. All of these pathways are targeted by some pharmaceuticals, so it's interesting to see a natural compound affecting them too. Overall, reishi shows an immense amount of promise as a complementary therapy alongside conventional treatment. It may reduce inflammation, improve immune balance, and possibly lower disease activity when used alongside standard care. It's important to note that most of the research that has been done has been on cell and animal models or early pilot preclinical studies. Altogether, these findings underscore reishi's multi targeted effects and the need for more human clinical trials. Thank you so much for listening to my presentation, and I hope you have a great day. After exploring